Hi, everyone. I'm Dennis Snyder, and today I'll be talking to you about using healthcare cost comparison tools. Although it is not legally required, healthcare is one of the most common benefits that employers offer their employees. Health insurance coverage, along with retirement and 401k, is a super common benefit that employers will offer their employees. So making sure that you're familiar with it and you have a basic understanding of it is key in maximizing your savings and also maximizing this benefit. As we know, it isn't legally required, but many of the time companies, especially ones with over 50 employees, will provide coverage as the Affordable Care Act of 2010 puts minimums on health insurance for coverage. And in this act, trying to get as many people insured as possible, companies will offer this health insurance to avoid fees from the United States government. Talking to your employer and understanding your options is key in picking a plan that's right for you. Using these healthcare tools are really important, but without having an understanding or basic understanding of health insurance and your needs, it isn't going to be very helpful for you. And did you know employers cover about 70% of US health insurance for workers? So out of the entire United States, 70% of health insurance is covered by the employer and not the individual. Typical employee plan. In today's system, there's more of like an online shopping and price comparison model, which is currently in effect, which is nice because it allows employees to have freedom to choose insurance plans that are right for them with a range of coverage and cost. Underlined here are two of the most common ones that I found is PPO and HMO. A PPO, or a preferred provider organization, is health insurance where members can receive care from anywhere, even if it's out of network. So they have a larger freedom of doctors, pharmacies, and hospitals to choose from, and that they are covered. But a downside of this is that they are a little bit pricier than the HMO plans. The HMO, or the Health Maintenance Organization, is you will select a primary care physician, and then your insurance company will determine your network, and you will only get coverage for doctors, pharmacies, and hospitals that are inside of that network, except for emergencies. So this really limits where you can go to get medical care, but an upside of it is at a lower cost than many PPOs. Um, the healthcare system currently is experiencing a lot of turbulence and change. Health insurance costs are the highest expense for many employers, and the number is only rising according to market data. Premiums from employer-sponsored coverage have increased 54% in the past 10 years, and since 2009, contribution rates have increased by more than 62%. And these contribution rates, as we learned from this class in the book, are when employees pay their employer a certain fee at the beginning or however it's structured to help the employer offset some of the costs from this health insurance. Uh, Recently, it's been a trend for businesses to pass their increasing costs off onto their employees as much as they can in forms of these contribution. Higher premiums and higher copays are also becoming much more commonplace. So making sure you know you have these tools accessible to you to help you save money is more important than ever. And this graph here shows since 2009 the increase of premiums and also worker contributions. And as the data shows, it's going to continue to rise, and it has rise since this study was put out. Choosing the right coverage is really important when navigating your health insurance tools and using these online tools that are available for you, because making sure that you save money while also receiving exceptional care should be your main goal. What many companies do is they have something called an HSA or a health savings account, and it allows for individuals to choose what they want to have covered, such as vision or dental insurance. This is really a cool benefit as it allows for different employees and individuals to pick coverage based on their needs. Private health insurance has increased in price every year since 1999. So now more than ever, using these online tools, hotlines, and specialized agents for shopping plans is super important. There's hundreds of tools available on websites for shopping prices and comparing coverages. First, seeing if you qualify for a government-funded Medicare or Medicaid is a great first step, as you can receive health insurance at little to no cost to you if you qualify. But for people not qualifying, there's hundreds of private websites that will generate quotes and find different items all across the internet after you enter some basic information like your employer, your name, where you're from, and your general salary information. And even some of these websites that I found while doing my research would send a quote directly to your email or mobile device for free. Here is an example of what one of these websites looks like. This is affordablehealthplans.org. I entered some of my information, and here it shows me a range of different plans that I can pick from a range of different providers. And this is all for free, but also, as you can see in the top right, they do have a toll-free number that you can speak to an agent with. With health insurance rising and lots of benefits are being slashed from employers, it's really important to save your money and also maximize your benefits from your employer more than ever. These online tools and resources are super available for people looking to enroll in health insurance plans. When I was doing my research, I probably found 10 to 20 very good websites within the first 2 or 3 minutes of being online. And just lastly, make sure you understand your needs and coverage so you can save money and receive quality care. Thank you.